Hello, it's my pleasure and delight to have you join us on this week's edition of the program Healthcare. My name is Rebecca Jod, and Healthcare is coming to you live from the Plateau Radio Television Corporation here in Jos. And as I often say, it is always a pleasure, it is always a delight, because we are always here with one issue or the other that we want to pass a message across. We want to inform you. We want to yes, these myths, these misconceptions that people have, and we want to tell you that there is hope, because once you are healthy and you are watching us, we are always very happy and always delighted. So today on the program, we are still going to look at one issue that we have talked so much about it on health care. We are not done with it yet, because you hear a lot of stories. You hear the challenges of people this day as a result of that medical condition, and that condition is cancer, the cost of cancer treatment. Yes, not only the diagnosis, but the cost of its own treatment, the financial challenges facing the patients and also the families. Because once you are diagnosed with it, you begin the treatment, and one story or the other begin to come up concerning the issue of finance. So that will be our focus today on the program. And I have with me by my right, Mrs. Peret Dasplang Biguan, who is a breast cancer survivor. Peret is not tired of telling her story because she wants to give you hope. And each time I looked at her, I can't help but just to smile from inside to outside. So, Peret, you're welcome.
Thank you, Ma.
Yes. And by my left is Dakat Christopher Haruna. He is the former president, Jos University Medical Students Association, that is JUMSA, and he is the head of communications, Pink Ribbon Cancer Foundation. Dakat, you're welcome.
Thank you very much, Ma.
Yes.
It's a pleasure to be here.
Thank you.
Again.
Yes, so they are here, and you know we've been talking about Pink Ribbon Foundation. This is a foundation that has given its head, its neck, its body, everything to make sure that the patients of cancer, their hope is kept alive. So a lot of volunteers are there. So we appreciate Pink Ribbon for that effort that they have put across. So it's my pleasure to have you.
Thank you very much, Ma.
Yes, so we are talking about the cost of cancer treatment, the financial implications, the challenges, and all the likes. But before we will move to that, let's still just establish, because you hear cancer. So what are some of the common types of cancers that we hear about that we also witness?
Oh, thank you very much, Ma. Hello, everyone, once again. So basically, cancer is, I'll just start by telling you what cancer is. Cancer is a disease that occurs when cells within the body refuse to die. So they just continue reproducing. Ordinarily, they should die after they accomplish a certain amount of time in the body. But when they refuse to die, they become what is known as cancer. Now, as to the types of cancers, there are lots of cancers. As long as you have a part of your body then that is alive, then that part of the body can have cancer. So you have cancer of the eye, cancer of the skin, among others. But common among us here in Nigeria, for women, we have breast cancer, cervical cancer. And then among men, you usually have prostate cancer and liver cancer. But generally speaking, there are other cancers, like lung cancer, you have skin cancers, we have colorectal cancers of the digestive tract, we have a lot of cancer, even cancers of the bone. These are very common cancers that we have all around us. There are even sometimes that you have childhood cancers, children that are born with cancers or that could develop cancer at a very young age. We also have blood cancers like leukemia and the rest of them. So this is basically what cancer is, and these are the common cancers that we have and we see around us today.
Okay. You talked about children. That was to be my next question. So does it now suggest that it is hereditary, or what can we say if we begin to talk of maybe children born with it?
Yes. So usually when a first degree relative, maybe your mother or your father had or has a cancer, it is very likely that you would also come down with cancer. So first degree relatives is one of the risk factors. It is not saying that because your father has it, definitely you must have it. But it is one of the common risk factors that we have for cancers, because one of the reasons why these cells, as they are reproducing, they refuse to die is because there is a genetic mutation somewhere in the DNA. Something changed, and then that is what is now making the cells to refuse to die because of that change. So, and it's basically transferred from parent to child, those genes. So yes, when you talk about cancers, one would have cancer. So yes, that's one of the reasons why children could also come down with cancers.
Okay, thank you. So, Parrot,
Yes, ma'am.
do you have the history of cancer in your family?
Yes, we have the history, but from my cousin's side, not directly my parents.
Okay,
Yes, ma'am.
okay.
Mhm.
So now, the cause of cancer treatment. When you first got the diagnosis, what was the first bill that shocked you?
The first bill, when they were suspecting cancer, they said they are going to take a biopsy. That I should just go and get the biopsy needle. So I was just thinking of maybe just this small syringe or something like that of 100 naira, 200, something like that. So when I got to the pharmacy, I was like, this is what I want with the prescription list. And then I was like, how much is it? They were calling 15,000 for me just to buy this biopsy needle.
That was how many years?
That was 3 years ago. For now, like this, I don't know how much it is. So when they said 15,000, I was shocked. I was like, 15,000 for what? Just a needle. 15,000. And then they will just choke you, and that's the end.
You can't use it again.
You can't use it again. So I was like, 15,000 for this. Okay, how am I going to cope along the line? You know, that was the question I asked myself. How am I going to cope? If a needle costs 15,000 naira, what of the rest of the treatment? You know? So honestly speaking, it's not funny.
Okay, okay. Okay, so looking at the journey so far,
Yes, ma'am.
and looking at the cost implication, at the first diagnosis, the first shock of the 15,000, did you know you would come this far?
No. Honestly, I didn't know. But one thing, I was like, the way this thing come, that is how the money is going to come for the treatment. Because I did not even keep anything that this money is for health issue or this money is for this and that. So I was like, this money, you must come. So along the line, the cause and the everything is God.
Yeah.
Yes, ma'am.
I like that strong faith that the way the cancer came, that is how the money will come.
Yes, ma'am.
That's a strong faith that we need to keep us moving. Okay, so now, Dakat,
Yes, ma'am.
looking at this now, is cancer treatment a medical crisis or a financial crisis?
It is both, actually.
Okay.
It is both a medical crisis and a financial crisis. Like Mrs. Perret said, when she was faced with the challenge and came to the hospital, that was a state of medical crisis. And then she was asked to buy something. And then she went and was shocked by the price of just the needle, not to talk of the act itself, and not to even talk of medication. So now that shock that she felt was the financial crisis. So it is both a medical crisis and financial crisis. And one may ask, I mean, beyond the pain or the symptoms that one will be experiencing, these financial things is because most of the times hospitals are not funded. So some of the equipment that you need for the person to be treated or to have those investigations done, they are not readily available. So the body now goes back to the patient to go and get it. And also health insurance most of the time does not cover cancer. If you have malaria, you can with health insurance. You have fever, any other disease, most other diseases, I mean. But when it comes to cancer, everybody wants to run away from it because it is very capital intensive. And that's why we are here, to raise awareness so that the government can intervene. People are already dealing with the medical aspects. Let them help with the financial aspects.
Okay. Yeah, I love that. The patient is dealing with the medical, so the financial, someone else can't actually,
help.
help with it. But looking at this cancer, you discover that from the little experience and maybe people that I have seen, except when we come back to Peret, we'll find out how early she went to the hospital. But how is it how does it predispose itself that most times you discover that this thing comes to people as a surprise, as a shock, or late? They present late.
Okay, yes, so with regards to this, there are many reasons, possible reasons for it. So, firstly, these days, people are growing older, people are living longer lives. Of course, when you go on the street and ask people, people will say people are dying younger now compared to olden days, because everybody feels like their own grandfather was the one that lived to 150 years, But it's not everybody that used to live up to that age in the past. So people are growing much more older now, and there are many other factors. You see, tobacco, alcohol consumption. These days, we are not just drinking the burkutu of then that maybe did not have additives and all, and had on average maybe just 5% to 10% alcohol. Now people are mixing a lot of things. We also have things like obesity predisposing. We have infections that are causing cancer to be more widespread, like hepatitis B virus. We have the human papilloma virus, HPV, that's responsible for cervical cancer, among many other infections that could cause cancers. You also have the fact that these days there are more technologies available that when somebody goes to the hospital, we can now say that this thing that is disturbing you is cancer. Back then, we did not have these things. So somebody may have a swollen leg and die because of that swollen leg, and they will say maybe he offended the gods or he stepped on somebody's farm in the village, and that is why.
Yes.
So you would see that these are the things that are making people to have more awareness, or you see that more cancer cases are available because of these predisposing factors that I have listed.
Okay, thank you. So, Peret, how early, did this intervention come? When you discover it, how early was it? Because there are times that people sometimes go to the hospital at a late stage, and we've been advocating early detection. So how early was it?
Okay. I went at stage 2.
Okay.
Yes.
So that means you didn't even go at stage 1?
Yes, ma. Because, it's something that is painless most at times. You won't feel the pain. You're just seeing something funny, but you're just, in your mind, is something that will just go away with time. So, and the pain is not there to now push you away to go to the hospital. So you just be staying it with the, what you're feeling, just like that. So before you go to the hospital, sometimes it might be late. So what we're trying to say here is that any funny things you discover around your breast and the rest, you should just go for checkup. Let the hospital tell you that this is what is happening.
Okay.
Yes, ma'am.
So now concerning the cost, beyond the chemo, the surgery, and all the likes, what are some of these hidden costs that you didn't know? Maybe you were just preparing, okay, I need money for chemo, for surgery. Were there some hidden costs that you didn't know until the journey started?
Yes, ma'am. Like all these laboratory tests, you want to go and do a CT scan, they are calling about 70,000 to 80,000 naira. We also have a fish test. This test costs for like 800,000 just for the test to be done. And we also have PET scan test, which goes for like 1.3 million just to get that test done. So all these ones are some of the hidden costs, because we were not even planning along the line that with time we will pay for this, we are going to do this one, apart from the mastectomy, the radiotherapy, and the rest. So all these costs adding, and then there are some injection along the line. We have a sister that after her chemotherapy, after her surgery, after her radiotherapy, she's still on Herceptin injection. And Herceptin injection costs, it goes for 1.3 million. And then she will take 18 course of Herceptin. And then you will take it after every three weeks. So imagine this cost 1.3 million for just 3 weeks. And you're going to take 18 of that. Where is that money going to come from? And even apart from that, she's also on another injection called Zoladex. Zoladex goes for like 400,000 all. And that one too is after three weeks. So when you add all these costs together, it's going to be something else. No matter how much you have keep aside or you kept for all these things, I'm telling you, it's not going to be enough. We are not even talking about the transportation money.
Yeah.
We are not talking about the accommodation, because all these things sometimes is not going to, you have to go and look for where that thing is. You know, sometimes you travel out. Okay. How much is the cost of transportation, the accommodation, your feeding, and the nutrition, all the food that you as the patient you're supposed to eat. They say eat healthy. So all these costs, when we put them together, honestly speaking, is something that is not just okay.
Okay.
Yes.
So your treatment, is it basically in Jos, or you've had to travel outside of Jos for your treatment?
It's not just in Jos. I travel to Abuja for my radiotherapy because their machine here, they don't have it here in Jos. So I have to travel out to Abuja. And then these tests I'm talking about, this PET scan, the fish scan, even in Abuja, that test, you have to go to Lagos. And I have to travel from here to Lagos for all this.
Wow, it's a huge burden. It's a huge burden, but the bottom line is that she is still here, bubbling with life. So in the course of it, we want to we'll find out how she is able to, all these millions that she is calling. You know that these 6 digits is not an easy thing, but we will find out, and at the end of the day, we want to sum it up as to how we will all be together to make sure that those digits, the burden is removed from the patient. So now, Dakat,
Yes, ma'am.
this treatment that she is calling all this huge sum, why is the treatment for cancer that expensive? Let me use that word, on the high side, even though you cannot compare life with finance, but why is it that high?
Okay, so these things are very expensive, and I will say this from the start. We do not have enough healthcare facilities in the country. So imagine a woman having cancer symptoms in maybe a place like Okari. She either has to travel all the way to maybe Jalingo to access healthcare because the facilities there are not available for them. Or let's say like Shandam, she has to now travel all the way to Jos to access healthcare. So now you're already looking at the access to healthcare facilities as one of the reasons why care for cancer would be very expensive. Because the person may have even started because they are scared. They may have heard stories about the cost of cancer, and then they will even start by running around prayer houses, traditional medicine men, and so on and so forth. In fact, I've heard that there is a place in Mango, or is it Gindiri, that they are treating breast cancer there. But you see many of these people, after they go there, they come back to the hospital because the case is complicated. So, back to the reasons why these things are expensive. Firstly is the distance to access healthcare. Secondly, the presence of specialized healthcare practitioners. We do not have enough healthcare practitioners that can actually cater to these issues. So the fact that the person is not just about the hospital now, it's about where the individual that will actually treat that case is. So that also contributes to the cost. Okay. And because it's a specialist that is needed, you know that the rate to meet a specialist is different from a basic KEDA healthcare professional. Then you now talk about the facilities that are needed, the equipment needed for the investigations for these cancers. You will see that, for example, the biopsy needle, you will not go and use normal needle for sewing clothes to do this. You understand?
The one they will just choke you with it and
you will not
off
do
you
that.
go.
You will not do that. So it has to be special equipment. And this is just for biopsy. She spoke about the PET scan. Very correct. The equipment for the PET scan machine, that's the PET scan machine itself, costs into hundreds of millions. In fact, besides, if you do not go to Abuja, I know that in Abuja now there should be the AMCE, that's the African Medical Center of Excellence, has a PET scan there. But then if you would see that the investments, not everybody has that money to invest into getting that machine to bring to a place like maybe Jos. As it is now, they are building a cancer center in the Jos University Teaching Hospital, and we are hoping and praying that these investments come and these facilities come to be able to, attend to our people. So you also have even the CT scanners. They are not readily accessible. In Jos we have CT scans. We have CT scans all around. But then you would now see that the equipment are very expensive, not just to purchase, but to maintain. You see that it's not like X-ray that if there is no light, no problem. If it comes to something like MRI, it has to run on 24 hours electricity. And you know that that is not really obtainable in this part of the world. So you see that to maintain the generators and whatever that will keep it running has a very big cost. So that is another part of it. And then you now see, like she rightly said from her lived experience, when she was traveling to Lagos and to all these places for her investigations and treatment, she didn't travel alone. She must have had to travel with one or two people that will offer her care and support during these times. So you're looking at the accommodation, you're looking at the feeding, because you're not going to go there and then the hospital just give you food because you are their patient. You must cater to that as well. So usually when people have this diagnosis or they begin to have these symptoms, their first instinct is to look for the easy way out, and which is one of the reasons why many of them come when the case is already complicated. But you see, when the disease is caught in its early stage, it is easier to treat. So now I just spoke about the investigatory equipment. Even the equipment for the treatments is also expensive. The drugs for chemotherapy, chemotherapy should be like 60,000, 70,000 per cycle, but then the person has to do multiple cycles within a short span. So you see that even with this 60, 70,000, you're spending almost $1 million or more just for chemotherapy. Not to talk of the other drugs. Some of the medications cost more than 2 million naira. So these are some of the things, because we do not produce these drugs, we do not have the technology to produce them here, and then the companies that produce them, they have to get reward for their labor and also the investment they have put into the research for the medication. They have to get it back. So that is one of the reasons why, these are the reasons why you would see that the cost is very expensive. And when people hear this, like she rightly said, you do not keep any money aside to treat disease. And even if you did, maybe it was for things like malaria or childbirth and so on and so forth. You didn't plan to have cancer where they will come and be calling 1 million, 2 million for you, and all of that. So people begin to sell their cars, people sell lands, investments, and all of that to be able to cater for it. So it's a really sorry situation. And because there is also no health insurance, so you have to now pay every single thing out of pocket. So these are the issues that we are facing. Yes.
Thank you. Okay, so now, parents, with all this, it's a huge burden. It's a challenge, but again, it cannot be compared with seeing you the way you and looking. You can't put that money and life and compare, because it has no basis. But in this journey, was there a time that you had to delay a treatment because the finance was not there? And how did you cope? Or are there people that that with all these cycles that mentioning, they had to delay it, and what is the implication?
Okay. In my own case, I would say that I didn't delay my treatment because of the kind of family members I have around me, friends, and even the community. Anything I want to do, if the medication, whatever, if I just say it out, we pray over it, we just pass the information across these family members, and all these things will be available for me. But I've seen a lot of women, a lot of people, that even today, their treatment is something else. Not that they don't want to go about with the treatment, but because of the cost, the money is not just there. The family members, even if they gather the entire family, they cannot be able to produce or provide that money for them. And they don't even have anything to sell. Anything to sell, even asset or even where to even borrow money. Where can they go? You go to borrow, nobody will even listen to you. And then there are some that even their medication you want to buy, you want to call somebody. Even when they see your call, if they see your call, they will be like, this woman, she want to disturb me again. No, I will not even pick the call because I know what she's going to say. So things like that, before you know. And cancer will not wait for you to go and look for money. The cells will keep growing, multiplying like that. So it will not wait for you. So at the end, what can you do? In the end, is something else. Yes.
Okay. Thank you. So now, were you working before, or did it affect your productivity, your job, or whatever as a challenge?
Okay. I was working with a private school. So when I started this treatment, I was like, how can I combine the two with my work? Because chemotherapy can just bring for yourself. You're very weak. You cannot cook when you take chemo, this thing. So even my husband that is working, he's working with his Oga in Lagos. The Oga have to just send him back home. He told him that, go, take care of your wife. If she's okay, you can come back to office. So with that, you see, the work that he's doing, he have to drop the work aside and come back home to stay with me, to also take care of me. So all these things, it affected him and also me. Coupling with the children around me. Whenever they look at me, they will be like, my first son is, he will be 13 this September. Sometimes when he just entered the room and see me, do you know he will go somewhere and hide? He will cry. He will cry. And then when I heard him crying, I will call him. I will be like, why are you crying? Am I dead? Why are you crying? Then he will be like, Mommy, I don't like seeing you like this. And coupling with what chemotherapy can do to your hair. So I don't know whether it's because when he saw my hair, there's no hair, and then he will be like. And then my little girl, she's 6 years, she will come and lie